So someone asked about the Argyll Robertson pupil and comparing and contrasting that with the attention-tonic pupil, but specifically the long-standing attention-tonic pupil, which has become chronic and small pupil, and we call that little old addies. So the little old addies can look superficially like the Argyll Robertson pupil. So the Argyll Robertson pupil, and if you remember the afferent pathway for the pupil again, midbrain, and where the problem is in the pretectical nuclei talking to the Edinger-Westphal nucleus. So in the Argyll Robertson pupil, which is typically from syphilis, that syphilis is right here. A tertiary syphilis, a neurosyphilis, affecting this pretectical afferent pathway. And you'll have decreased light reaction because the light reaction from the optic tract carried from the retina and the chiasm and the optic nerve is impaired. And you'll have a preserved near reaction because the near center can still talk to the Edinger-Westphal nucleus without the pretectal nuclei and without the afferent input from the retina and the optic nerve. So in the Argyll Robertson pupil, it's a pupil that accommodates, and by that means it reacts at near, but it doesn't react to light. It's typically a small pupil, and it's slightly irregular often, small and irregular. And then you shine the light on it, and it doesn't do anything, but then you do the near, so it goes from small to pinpoint. So it goes from small to even smaller. So small, irregular, bilateral to pinpoint. The key and differentiating feature is it's not tonic. So tonic means it constricts and it stays down. So in attention-tonic pupil, you have a larger pupil initially. It doesn't respond to light as well. It has a sector paresis, and therefore it might be irregular because the segment isn't responding. There might be vermiform movements around it where the normal pupil. And the near reaction is better because you have light near dissociation in the attention-tonic pupil. Over time, because of aberrant regeneration, the pupil gets smaller and smaller and smaller. And that means it can superficially look like a small and irregular bilateral pupil, like the Argyll Robertson pupil. And again, the light is poor and the near reaction is good. So far it looks very similar to Argyll Robertson. But the difference is, in the little old addies pupil, it's gonna be tonic and stay down, and it won't release right away. So the little old addies is tonic, and the Argyll Robertson pupil isn't tonic. It's small, irregular, goes from small to pinpoint, and then it releases right away. Either way, you should probably do a syphilis serology because a bilateral attention-tonic pupil and an Argyll Robertson pupil are both signs of syphilis. So it doesn't matter whether you're dealing with a bilateral little old addies or a bilateral Argyll Robertson, you should test the person for syphilis.